So some of the common things that we hear is that, how do I invest this kind of money into, and not that it's a lot of money, but just investing into clinically managing oxygen patients or into changing up the vent model. It seems like a big lift. And oftentimes people they meet with us, they get excited, and then they get a quote and say, wow, I just can't do this. But it's really the idea that says if you invest today in your clinical outcomes program, you're going to see returns tomorrow. And it may not be literally tomorrow, but down the road. But there's some pretty immediate returns too. So some of the objections that we get are, how do we get over this lift? And one of the things that we do, we had somebody the other day that said, hey, I've got 10,000 oxygen patients. If I put all my patients in a program like this, it's going to cost me, tons of money a month. And so there's ways we do that. A couple of the ways are we start with smaller populations, targeted populations that we manage, and then kind of rotate patients through the process so that as we're clinically managing them, we're identifying the ones that have problems, and the ones that are doing well, we don't need to continuously call or do outreach to. So we've got a couple different ways that we keep the cost down, but still can do a model like this, as well as we've got ways that that we can kind of ease the burden up front to be able to get into something like this. So it is a mindset change. I believe it's one of those things, like I said before, that if you don't do it, it's going to be hard to compete with people that are doing something like this. At the same time, you got to make a decision that philosophically you're going to change the way you've done things, and that takes a little bit of time. It takes buy-in from the top, it takes buy-in at every level, and where we've seen this the most successful is where you get the buy-in from leadership, and then it trickles down to the rest of the team, and there's some excitement about, hey, we're going to change the way we manage patients, and in doing so, it's going to be better for the patient, it's going to be better for your business. And so it's really that mindset. Other objections are, I don't have time to do this. And if you're talking about the oxygen model, the idea that you don't have enough time to do it, I would say that it really doesn't take much of your time. It's your sales team generating information for your sales team to go out and have something more to sell. But that is their job, right? But on the clinical side, we do all the lifting for you. And so once we build a report in your billing system, or we generate a way for us to be able to consume data from whatever system you use, which, by the way, we've got integrations with Brightree, Bonafide. We've got Nico that's about done, working on Tim's next. So we've got several integrations that we do with billing systems. All the major billing systems out there we're working with. So if we don't have integration, we can still set up a report and be able to pull that data into our system and be able to enroll those patients. So we do all that work for you. Once you set it up front, we're going to do all the lifting. We're doing the outreach to the patient. And a lot of times you might think, well, does this mean I'm going to have more on call or more times that patients are calling in needing things? And it's actually the opposite effect. We had a large company in one of the states in the Southeast where, after doing our program for a couple months, they recognized that they had an entire weekend where they went with 0 after hours on calls for the whole weekend. The first time that happened in years. And the reason is because we engage the oxygen patients proactively. We identify the problems that they're having, and when we find problems like they need tanks, they need cannulas, they need whatever it is, or they're having a problem with their device, we find it before it's Friday afternoon and they remember to call you because they're going out of town on Saturday and they need portables. So we find it early, and then we get it to your team so that it can be taken care of on a scheduled route versus an after hours call. So that's one of the objections we get, which generally is kind of the opposite effect of what we see. Other objections would say, how do I sell this, or how do I go talk about this to the physicians? And that one I would say is not as much an objection as, again, kind of the mindset shift of going after a clinical outcomes model and trying to figure out, how do you do that? And that just has to be a decision that you make, that I'm going to do something different, and I'm going to be able to raise the bar, if you will, in my territory. I've seen a lot of companies that they want to be the first, and so their question is anybody else doing this in our territory? And if the answer is no, then they're all in and they want to be the first to bring this to market. Other companies I talk to that say, I want to do this, but I don't want to do it until somebody else does it and proves it. And so it really just depends on your mindset, right? I understand both sides. It's the whole concept of the tipping point of you're going to have the people that are kind of the point of the spear and want to be the first, and then you're going to have people that say, let's make sure it works first in our territory, the docs adopt it, and then we'll come in and do it. But it's really just about where you want to be in that. I like to be the front of the spear, right? I want to be the first to market with it. I want to be the first to sell it, because here's the deal is when you gain access to those tables and to those conversations, and you're having that high level conversation with large pulmonary groups or with hospital systems, if I can lock it up in that first conversation or in those first interactions, then the likelihood of you coming in and taking that from me is going to be much lower, right? If I've already got a relationship where I've been doing a model like this for 6 months, I'm taking good care of patients, great outcomes, the referral process is solved, the case management loves us, and we're doing something like this, then it's going to be hard to come in and say, hey, I'm also doing the same thing when it's already been built, the infrastructure's been built. So I would say that being the pioneer means that oftentimes you lock up more of the business. Maybe a more conservative approach says that you don't waste money on something that may or may not be successful. But what we've seen is that it's not a may or may not anymore. There's so much success in the marketplace doing these types of models now that it is going to become the norm, and it is quickly becoming the norm of what people are doing in the industry. So I would say that most of those objections are easy to overcome, but they're also, when you're on the other side, I understand. I've been on the DME side. I've been in operations. I've done almost every job in DME. And when somebody comes in and says, hey, here's a way to change the model and grow the business, there's a lot of things that go into that, right? There's a lot of things you have to think through. How's this going to affect this department and that department? And so I understand that doing something like this is a mindset shift that has to happen, and it's an investment. Even if it's not a lot of money investment, there's time that gets invested and there's resources that get invested. But I'll say that at the end of the day, you won't find a customer that's been using us for more than a year who is not happy with the service and not seeing growth in their business and not seeing their sales team elevate to a new level. So whatever the service is, you won't find somebody who is a long-term customer of ours that hasn't seen massive success. You'll find some customers that didn't do a real good job of engaging it, didn't do a real good job of launching it. And so you might find one that says, hey, it didn't work for us because we weren't ready for it. Nobody will ever say Encore didn't do their job. And I'll guarantee that, because every customer we've had, even if we weren't successful in them being able to convert patients or grow that business, we generated the leads, we generated the data, we helped to elevate the sales team. So I would say that it's really, are you ready? And if you're not ready, how do we help you get ready, instead of waiting to see if everybody else around you starts to do something like this and then it's too late.